I'm Mrs. Princey, Associate Professor in Mental Health Nursing. I've got a case of a 20-year-old female who had a complaint of joint pain, that is the arthralgia, as well as the lower back pain. She had no history of any kind of injury, but she also had the complaints of trouble sleeping at night and was not feeling good, or she felt that she could not rest well at the night. She often felt that she was restless and was on edge, which was associated for the reason that is not sleeping well at night. She says that she constantly worries about her life, that is the performance in the school, performance at home, in the family, as well as her mother, who has been recently diagnosed with a small cell cancer. She says that she wakes up in the night with a throbbing headache and it moves on for a couple of hours with the headache. She feels tensed most of the day, causing her to feel stiff. Yeah, that is a scenario about this 28-year-old, women. I've got another case of a man who is again 28 years old who had the complaints of excessive worriness, not able to control this, worriness and apprehension that his mind would go blank and that he will lose his mind if kept on worrying. He also had complaints of fear of being inadequate at work, unable to concentrate at work, anxiety, as well as the tiredness. He also reported disturbed sleep and muscle tension. So, if you look into these two scenarios or these stories, you can clearly make out the client is undergoing some kind of anxiety or some kind of stress. So, both the condition are related to the generalized anxiety disorder. So, the topic for discussion is the generalized anxiety disorder. What is this generalized anxiety? Generalized anxiety disorder is a mental health condition characterized by the symptoms of ongoing or excessive worry, being nervous or irritable most of the time, difficulty in concentration, as well as increased heart rate. So these are the characteristic feature of the generalized anxiety disorder. Let us see the definition of generalized anxiety disorder. GAD is an anxiety disorder which is characterized by excessive, uncontrollable, and irrational worry about almost everything. So whatever the person undergoes in his life, he keeps on worrying about each and every matter, how trivial the matter is, right? So he keeps on having the worriness which cannot be controlled by the person, right? So such a kind of a disorder is called as generalized anxiety disorder. It is a common chronic disorder characterized by long-lasting anxiety that is not focused on any object or situation. There is no particular reason or why a person is anxious. There is no particular situation, no particular object, but generalized, okay, for each and everything. Most of the time, the client keeps on worrying and gets irritated, will become very much anxious. So that kind of a common anxiety disorder is the generalized anxiety disorder. What is the etiology? We have got the role of the biological factor. In the biological factors, the role of the neurotransmitters. So we have got the neurotransmitter theory. So according to this theory, they say that if there is a dysregulation in the serotonin system as well as abnormalities in the other neurotransmitters like norepinephrine, serotonin, glutamate, as well as the cholecystokinetic system. Okay, so all these area, if the neurotransmitters are disturbed, then the person is predisposed to a generalized anxiety disorder. So that is what is the neurotransmitter theory. The second theory, which explains the biological factors, the neurostructural theory. They had done the CT of the brain of such a kind of a patient who was suffering with a generalized anxiety disorder. They noticed that there is a lower metabolic rate in the areas of basal ganglia as well as the white matter of the brain. So that is what was noted in the neurostructural theory. The next one is genetic theory. So there is a chance about 25% of the first degree relatives who have been affected with the generalized anxiety disorder to pass on this to the other people in the family. And if you take the twin studies, the monozygotic twins, there is a 50% of another twin to be affected or develop this particular generalized anxiety disorder. If it is a dizygotic twin, there is a 15% of the chance to be developing this particular disorder. So that is about the genetic theory. Apart from this, we have got the change in the sleep architecture, the circadian rhythm changes in terms of increased sleep discontinuity, decreased delta sleep. We have got these stages of the sleep. So if it is noted there is a decreased delta range of sleep, decreased stage 1 sleep, as well as reduced rapid eye movement. So all these conditions which are contributing to disturbance in the circadian rhythm can contribute to even the generalized anxiety disorder. So that is about the first etiological factor, which is the biological factor explaining about the neurotransmitter abnormalities, the neurostructural changes, the genetics, as well as the sleep-wake cycle. The second factor we have is the psychological factor. It is the psychosocial theory. So under this, we have got the role of the psychoanalysis. According to Sigmund Freud, he says that anxiety is a symptom of unresolved conflicts which are being stored in the unconscious level of the mind. Any kind of a trauma that a person underwent during the childhood period, it can be a death or abuse of a parent or a death of a parent, any kind of childhood abuse, any kind of exposure to major stress like a family crisis or any kind of a stressful event that the person underwent in the earlier life period, all these can contribute to the anxiety disorder. So that is about the psychoanalytical theory. So this is the reason or the etiology we can say of the generalized anxiety disorder. Moving on to the course of it, the usual age of onset is variable. Okay, it can happen at any particular age group. There is no fixed age group that this age will be affected or develops this disorder. So approximately we can say about 25 to 30-year-old age group can get affected or develop this disorder. If you take the gender, it is seen 2 to 3 times more in women than in men. And also it is common in the elderly population. Okay, so that is the course of the disorder. Moving on to the clinical features, you can see the overall clinical feature that the person may have increased muscle aches or soreness, impairment in the consciousness, irritability, difficulty in sleeping, restlessness, fatigue, and excessive anxiety as well as the worry. So let us see about these clinical manifestations as per the various systems. If you take the autonomic symptoms, okay, we have got the autonomic arousal symptoms wherein the features are palpitations or pounding heart or the accelerated heart rate the patient can actually feel. There may be sweating, trembling and shaking of the limbs, dry mouth. If you take the symptoms concerning the chest as well as the abdomen, the patient complains of difficulty in breathing, feeling of choking, chest pain or discomfort, nausea or the abdominal distress. The symptoms concerning the brain as well as the mind includes the feeling dizzy, unsteady, faint, lightheaded, feelings that the objects are unreal, that is the derealization, or also the feeling that oneself is distant or not really here. That is depersonalization the person can have. You may have fear of losing control, going crazy or passing out, and also fear of dying. The general symptoms, if you take, the patient complains of hot flushes or cold chills, numbness or tingling sensations, symptoms of tension which includes muscle tensions, aches and pains in the muscles, restlessness as well as inability to relax, feeling of keyed up or on edge or of mental tension, a sense of lump in the throat or feeling of difficulty in swallowing. Okay, so all these feelings are nothing but the symptoms of tension. I've got the other non-specific symptoms, which includes exaggerated responses to the minor surprises, or we can say that startling reflexes will be more, difficulty in concentration, mind may go blank, thought blocks that the client may have because of the worry and the anxiety. There may be persistent irritability and difficulty getting sleep because of worry. Right? So these are the signs and symptoms of the generalized anxiety disorder. Moving on to the diagnosis, how will you diagnose this generalized anxiety disorder? So you can do the diagnosis based on the ICD-10 classification of the anxiety disorders. You got to do a psychiatric evaluation to rule out the other mental disorders which are contributing to the similar symptoms. So you're going to collect the complete history, do the examination, the physical examination system-wise, because you can notice these symptoms system-wise, right? So you're going to do a physical examination, the general examination, you're going to do the mental status examination, you're going to collect the history about the client related to the traumas that he underwent, related to the genetics. You're going to collect the information related to the pre-morbid personality, stressful life events, or exposure to crisis situation. So all these history, as well as doing the physical examination, the mental status examination, you're going to rule out this condition of general anxiety disorder. Moving on to the treatment modalities, what are the treatment options available? We have got the use of pharmacological agents as well as the psychotherapy. If you take the pharmacological agents, we generally go for the anti-anxiety agents, which includes the examples of benzodiazepine group of drugs. We've even got the antidepressants, especially the TCAs and SSRIs. Beta blockers, that is propranolol, since the patient may have the palpitations, heart rate increasing, the chest pain symptoms. So we may have the ideas that he can have hypertension. We may go for a beta blocker drug. So that is about the pharmacotherapy. Moving on to the psychotherapy, what are the various psychotherapies which are helpful? The first and foremost important therapy we have got is a cognitive and behavior therapy. Not alone, we go for a behavior therapy or a cognitive therapy, but we go for a combination of a cognitive and behavior therapy, that is a CBT, wherein you're going to bring about a change in the cognition or a distorted thought, and also modify the behavior of the client, teach him the various coping mechanisms or various behavioral modification techniques and cognition changes, so that the client can be really benefited. The next therapy is a supportive therapy, since the client can undergo such kind of an anxiety disorder on a chronic state, right? So always it is required that the client gets a support in terms of reassurance and comfort, right? So it can be even the family or the psychotherapist who should provide the support to the client during the chronic phase of this anxiety disorder. The next thing is insight orientation therapy or the program, especially to make the client realize or to bring the awareness in the client about those unconscious conflicts that he had in his mind. So it can be related to the previous traumas or abuses that he had underwent or crisis that he had underwent. So which is being shown in the form of the anxiety, or maybe the poor ego system that he had developed, right? So you're going to bring an insight, make the client to perceive those, bring in the awareness about those unconscious conflicts, and then release it out through the catharsis, right? So that is one is the insight orientation therapy. You're going to really make the client to become aware about the cause and also try to intervene it. So that is about the various psychotherapies that you're going to use for the client. Moving on to the nursing management. So if you take the nursing management, you've got the nursing assessment, nursing diagnosis, the interventions and evaluation, right? So first thing you're going to do an assessment, you're going to do a subjective assessment and an objective assessment. Subjective assessment, you're going to collect the information from the client, wherein you're going to assess the level of the anxiety, You're going to collect the information related to the history of abuses or exposure to traumatic events in his life. And also you're going to note for the physical symptoms objectively what are the symptoms the client is experiencing. So that is about the nursing assessment. What is a nursing diagnosis that you can state? You can state the diagnosis like panic anxiety related to real or perceived threat to biological integrity or self-concept evidenced by any or all the physical symptoms. What is the outcome criteria or the goal? The client will be able to recognize symptoms of onset of the anxiety and intervene before reaching the panic level. So that should be your goal. What are the nursing interventions for this particular diagnosis? Stay with the client and always give a reassurance to the client so that the clients feel safe and secure. Whenever you converse or communicate with the client, see to it that your approach is non-threatening and your approach in a calm and matter of fact approach. See to it that you use simple words and brief conversation that you can have, and see to it that you speak clearly as well as in a calm way so the patient will not become anxious. See to it that you keep the environment low of the stimuli. Maybe you can put a dim light free of noise and few people around so that the anxiety can be reduced. You can administer the tranquilizers or sedatives as per the order and note for the side effects. Whenever the anxiety level decreases, you have to be with the client and make him to get the insight or realization about what is that cause which made him to become very much anxious. So you're going to be with the client so that you can give an insight orientation. Teach the clients about the signs and symptoms of anxiety and the ways to interrupt the progression of these signs and symptoms by teaching him the various techniques like relaxation techniques, deep breathing exercises and meditations, physical exercises, brisk walk and jogging, which is going to make him to release such kind of anxiety in a constructive way. So these are some of the nursing interventions that you can plan. The next nursing diagnosis is powerlessness related to impaired cognition, as evidenced by verbal expressions of no control over the life situation and non-participation in decision making related to the own care or the life situation. What can be the outcome? The outcome is the client will be able to effectively solve the problems by his own self or make the decision, thereby decreasing the feeling of powerlessness. Okay, that should be the outcome. What are some of the nursing techniques or the interventions? Number one is you allow the client to take much responsibility that he can, especially related to the self care, which includes allowing him to establish some schedules for the self-care activities, including the client in the setting of goal of the care, providing the privacy that he requires, providing the positive feedback when he makes the decision. So these are some of the responsibilities that the client can plan for himself. The next intervention is assist the client in setting the realistic goals, right? The goals which actually he can meet. So those are called as the realistic goals. So it can be a very minimal goal, but see to it that you assist the client to set at least that minimal goal wherein he feels that confident on him. Rather than not meeting the goal and ending up with anxiety, you set the goals which the client can attain. Help the client to identify life situation wherein he can take control of. Encourage the client to verbalize the feelings or to ventilate the feelings related to his inability to perform certain tasks. Okay, so these are some of the interventions for the diagnosis of powerlessness. Okay, so overall, just remember to cope with the anxiety, you should remember the word aware. So what is this aware? You've got a mnemonic. A is the accepting the anxiety. W is watch for the anxiety. A again is act with the anxiety. R is repeat these steps. And E is expect the best. So A, which means accepting the anxiety. You accept that, there is a anxiety signs and symptoms in you, and you watch for these symptoms of anxiety. You realize these are the symptoms of the anxiety and you act on these symptoms, right? You take control over these symptoms and keep on repeating these steps to identify the symptoms, to act on these symptoms, and keep on repeating these steps again and again, and always expect for the best results. Once you have overcome the anxiety, you will really feel that kind of relief or a calmness. Yes, so just remember, the general anxiety disorder is simply the patient will have the anxiety or worry for all the matters, which is not limited to a particular object or a situation. Only thing he requires here is the reassurance, the therapies, the intervention, support from the group or the family, as well as to change his cognition as well as the behavior. Hope you all have understood the topic. Thank you.